Welcome to the informative discussion on COVID-19 with Guthrie, Arnot Health, and WYDC TV, Big Fox. I'm your host, Frank Acom, and I would like to welcome our guests from both Guthrie and Arnot Health. We start with Arnot Health. Please introduce yourselves.
I'm Jonathan Lawrence, President and CEO at Arnot Health.
And I'm Dr. Justin Nistico. I'm an infectious disease physician here at Arnot Health.
I think we should start with local numbers of COVID. What are we seeing of COVID-19 positive status in our area?
So what we've been noticing is that there has been a steady increase in cases over the course of the last several weeks, and that those cases are increasing whether or not it was due to the holiday season and gatherings or just because there is increasing spread of the virus due to the cold weather where people have been gathering indoors with each other.
What does this mean for us in the community for the upcoming holiday season? What should we know?
So the important thing is to know that individuals who are gathering are at increased risk for spreading the virus to each other. And what's important to note is that those individuals that could be at risk to spread the virus should be cautious in making sure that people who are vulnerable aren't exposed to the virus. So if you have elderly family members, individuals in your household that could be, immunocompromised or can get sick easily, we just have to be cautious and careful so that when we do think about the holiday season, we're just thinking about those individuals to protect them so that we ourselves can help stop the spread of this particular virus.
I think a big question that a lot of people wonder is when should someone be tested for COVID and how do they go about that at your facility?
So what we've done is that we basically look and assess each of the patients. So for individuals who should be tested for COVID-19 infection are individuals who may have developed symptoms such as they could have symptoms from having headache, fever, they could have cough, some mild shortness of breath or some shortness of breath that's different than they normally feel. Some individuals have a loss of something called a taste or smell. They may have loss of taste or smell, or they may have some upset stomach. So individuals who are symptomatic should definitely be tested. And the other individuals who also are at the forefront of being tested are individuals that may have had a very close exposure to someone with COVID-19, where they were in close contact with someone who has tested positive with COVID-19. At Arnot Health, we do have a very well-oiled machine in terms of our COVID testing, where we have a drive-through testing unit. And we have also, if individuals are thinking about getting tested, they can call our COVID-19 hotline, which is 1-800-952-2662. And a team of well-trained individuals will be able to answer some questions or ask them some questions about the symptoms they're experiencing and then connect them to an individual to get them tested.
Great. Now we hear a lot in both New York and Pennsylvania about hospitals being directed to increase hospital capacity. What specific things are your respective systems doing to accomplish that?
So this is something we've been working on since the outset of the crisis. Arnot enjoys a collaborative relationship with Corning Inc., who has a plant in Wuhan, China. So right from the outset, we were alerted to concerns. We'd been stockpiling personal protective equipment. So we have months of that on hand. We were proactive and acquired ventilators before they became in such short supply. So we have many more than we could need. We have the benefit of being a system with 3 hospital facilities. So we have plenty of beds available. And we have areas throughout our facilities, even if we were to use all of our typical hospital beds, we have beds and expert staff with advanced life support services and capabilities in various areas, our post-anesthesia recovery units, in our cardiac care unit, in our ORs, and in our procedural areas. So we can take care of more patients than a typical census number would have. Like most hospitals, we're prepared to be able to operate beyond our census. The real challenge right now for us and for other hospitals throughout this region And what we see throughout the nation is the limitation of staff. Our staff are not immune to the virus, and they are getting the virus in increasing numbers. And so this is challenging. We're seeing this in the nursing homes particularly. We've seen this throughout the community in prisons. We've seen this with emergency service workers. And now we're beginning to see it, particularly after the holidays, on our own teams here in our hospitals. So this is why it's so important for people to make sure that they're doing all the things they can to protect themselves and others, because it impacts our teams who would be here as the last line of defense against this virus.
Well, to piggyback off of that question, we go to WYDC TV Big Fox COVID-19 specialist Amanda Decker.
So how are your ICUs handling the increase in patients?
We're managing very well. We're actually seeing lower levels of volumes in the ICU than we did at the beginning of the pandemic. Our ability to be able to take care of people and the techniques that have been used, Dr. Nistico can speak to, but they've changed, and we've been more successful at taking care of patients in lower level settings. So there is not as much demand on the ICU beds as we might expect. However, it is increasing, and it's something that we monitor daily and closely.
Yeah, and we've noticed that with the advent of the new treatment modalities that we have, including the FDA-approved drug remdesivir, we have been using on certain patients who meet specific criteria that we've established in conjunction with other institutions and some national institutions on the use of the remdesivir. And we've noticed a good response for those patients receiving that medication.
Well, that's great to hear. Now, one of the things that I've heard from a lot of people are the concerns that some people that test positive for COVID have no real symptoms, and while others end up on a ventilator. Is there any way to determine the level of severity someone might, who becomes sick with the virus, might experience?
So typically what we're noticing is that individuals that may get diagnosed with the infection at home may start to feel completely fine. And really what it comes down to is a close monitoring of those symptoms. And if it's a family member that you're living with, or even yourself, just to notice that if you're worsening in terms of your symptoms, you're feeling more short of breath, or something doesn't feel right, it's always important to contact your primary health provider, but also to consider the possibility of receiving treatment at the hospital if you notice that you're feeling really sick. And the way we've done it is that we do testing in the hospital to look at certain types of labs that might be abnormal. And in some individuals, those labs, if they're abnormal, they could indicate a more severe type of infection. Some people don't feel sick right away. It actually takes a few days to start to feel really ill with this particular infection. But that's definitely something to keep in mind if you do get sick with COVID-19.
Now, at the beginning, we discussed the uptick in our area, and it's obviously a real concern. Do you anticipate having to again postpone non-emergent surgeries? And to add on to that, what is considered a non-emergent surgery?
So, of course, that's part of our contingency plans should needs require it. But we hope that that's not the case. But on a daily basis, we monitor what the demand is, what number of patients that are coming through our emergency department, the number of hospitalizations we have. And if we have to limit surgeries that are non-emergent, otherwise known as elective surgeries, then we do so in order to make sure that we have, again, not only the beds available, but we have the right staff to provide the right care in the right locations to all of our patients who need it. Elective surgeries are simply those surgeries that are non-emergent in nature, meaning that there is no threat to an individual's life or limb, and that delaying that surgery is not going to lead to increased morbidity, meaning increased illness, and it would not have any long-lasting adverse effects on the patient. It's something that could reasonably be put off without any adverse impact.
One of the discussions in our area and throughout the country obviously has been the emergence of a vaccine and maybe perhaps a light at the end of the tunnel. What do you expect in terms of COVID vaccine availability here in our region?
So it's definitely something that we are getting at one point. We're just waiting for the availability of the vaccine once it gets put through the appropriate FDA regulation. Once the vaccine is available, the goal is really based upon some expert opinion and our government organizations to make sure that individuals who are in nursing facilities throughout our area, as well as the healthcare workers, which are high risk of developing the COVID-19 infection, would have availability at the forefront. But in the future, our goal is to make the vaccine available once we get an appropriate amount of doses to the general public. And that is to be, figured out in time with, with the help of the government and with the help of, whether or not the vaccine company can provide those vaccine doses to us. But we're already prepared, and we have a task force at hand that's been working to discuss the rollout period, and we're going to get it hopefully in the hands of individuals in the general public relatively soon.
We now return to WYDC TV Big Fox COVID-19 specialist Amanda Decker.
And what would you say to those who are fearful of getting this COVID-19 vaccine?
So it's important to note that the vaccine is the first step in the fight that will really turn the tides, I believe, in this particular pandemic. And the reason I say that is because the way the vaccine has been reported and studied, it has shown great efficacy in reducing the amount of COVID-19 infections. And the important thing to note too is that the side effects that people are hearing about or even being discussed about is in general pretty mild. The most common side effect that we're noticing with the vaccine based upon the trials and the studies is just some local pain at the site of the injection. There can be others, such as some fever, chills, and some body aches, but it all has resolved for those individuals. And it is a plan to be a 2-shot administration, but the vaccine, what I would say is really the first step and will definitely help us make that first step towards normalcy again.
I recently saw a poll that the number is up for people that are experiencing mental health issues and kind of this depression because of whether it's lockdown, quarantines. What advice do you have for those struggling with mental health issues related to the pandemic?
I think really the important thing to note is that this situation is a trying time for a lot of individuals, but we still want to make sure that those individuals that are feeling this way, that they know that they have help. We have new technology now that has shown us to be very advantageous, such as Zoom conferencing or even teleconferencing with patients and their providers. We also have other mental health, individuals who essentially could be helping them, whether they're caseworkers, social workers, that all can do this teleconferencing. So they're not alone in this particular fight. And it is important to know that really for those individuals that we're really working towards getting back to a normal way of life and, to go back to the way things were, so to speak. And that's an important thing just for them to know.
And isn't it remarkable? You mentioned the technology with this telehealth, at a time when we're saying we can't have our normal holidays, what a great thing to have things like Zoom and all these various outlets where we can actually reach out to people. It might not be the same, but at least we can reach out to people and be close that way.
Yeah, absolutely. If there's a silver lining to any of this, it's that we find that people can be essentially alone, but not in isolation because of this technology that's available. And that's why, to add to Dr. Nistico's comments, we don't want to see anybody, particularly people suffering from depression or loneliness or anxiety at this time, to be suffering by themselves. So please reach out and call us if you don't have access to a caseworker or support staff, and let us help you get connected to some of these resources. There's no reason to be suffering in silence or by yourself.
Sometimes it seems like we need to go back to the basics of the early days of the pandemic. So what would you say to people, what they should keep in mind to stop the spread of COVID?
So, it's a question of taking a look at each of these things and how they fit together. Masking is not enough. Hand washing by itself is not enough. Social distancing is not enough. But all of these things together on a continuous basis will, you recall the term flatten the curve. It will reduce the number of infections we have to keep not only yourself safe, but just as importantly, your family members and others and the people who are most vulnerable in the community safe, as well as those on the front lines. And that's who we're most concerned about right now. The people in the nursing homes who are most vulnerable and the elderly with various conditions, and the people on the front lines who need to be there to provide the care to people who do have the virus. So this is why we've teamed up with our colleagues at Guthrie Health to ask everyone to please practice these behaviors and to be disciplined at a very difficult time right now when we all want to be together, when we want our families together, when our kids are home from school, and we want to be in the comfort of our homes with our families and friends. This is a time when we have to exercise extreme discipline and caution.
And you mentioned the people at the front line. What's the community outreach and the really the outpouring of thanks been like to you at Arnot?
Well, I think it's been tremendous. We've received letters and recognition cards on a routine basis, commending our staff who are among the best nursing and healthcare professional staff I've had the privilege of working with in my 30-plus year career. They demonstrate excellence every day and compassion, and they have come in and fought this COVID battle tirelessly. And they've been doing so for many months, and even after all this time now, it's increasing, and we're grateful for the recognition of the public to the efforts that our staff makes to make them comfortable and to be attentive to their needs, even under the most difficult of circumstances.
And if someone is just tuning in, when should someone be tested for COVID, and how do they go about doing that at your facility?
Individuals who should be at the forefront of testing are individuals who may exhibit symptoms such as loss of taste or smell, individuals who may have cough, shortness of breath. Sometimes they could have some abdominal upset or diarrhea and nausea, and those individuals should be tested, as well as individuals who are at a high risk or had gotten a high risk exposure for someone that had tested positive for COVID, where they were in close contact with that COVID-19 individual. So we have a drive-through clinic here. There's a team, there's a COVID hotline at Arnot Health. That's 1-800-952-2662. That's the COVID-19 hotline.
Well, gentlemen, I can't thank you enough for being on this program, and I also want to thank you for all that you do during this fight against COVID.
Thank you. It's our pleasure.
Thank you.
And now we'd like to welcome our friends from Guthrie. If you could please introduce yourselves.
I'm Dr. Michael Scalzone. I'm an Executive Vice President and Chief Quality Officer for the Guthrie Clinic.
And my name is Joe Scopoletti. I am the President and CEO of the organization, the Guthrie Clinic.
Well, thanks so much for joining us. And let's start with the recent uptick in COVID cases. With that coming off of the Thanksgiving holiday, what should we keep in mind going into the Christmas season, to the holiday season?
Well, as you mentioned, we're certainly seeing an uptick in cases all across the region. We're experiencing that at Guthrie as well. Compared to the spring, it's significantly more, and this has continued to increase. So following Thanksgiving, we've seen at least a 15% increase in the number of positive cases in the region and in our hospitalizations. And because of the holiday gatherings, we fully expect that that's going to continue to grow.
When should someone be tested for COVID, and how do they go about doing so at your facility?
So there are several reasons individuals should get tested, and we certainly want to encourage testing. The three that are most important would be, first, of course, if you have symptoms. If you have symptoms, you should contact your primary care doctor or get in touch with someone else that can arrange to get a test done. The second is if you think you have an exposure. So if you think you have an exposure to someone with COVID-19, that would be another good reason to get tested. Finally, a number of people get tested in the workplace because they are part of either staff for a nursing home or some other facility that has state-required testing.
I want to add to that testing for those people who are symptomatic and are not sure about going to a primary care physician can also be facilitated through a video visit. So there's a variety of ways you can access the Guthrie website so that you can obtain a video visit, and that can result in an order for your COVID test.
Thank you. Now, we hear a lot in both New York and in Pennsylvania about hospitals being directed to increase hospital capacity. What specific things is your system, is Guthrie, doing to accomplish that?
So this directive was in place as early as the spring. And back then, we began putting plans in place. So we've had what we call a surge plan that has existed since March or April. And as we get the direction from the state, we just implement step by step what that plan may be. It may include changing from one type of care in a unit to another type of care in a nursing unit. So we may expand into different spots in the hospital. We may shift some nursing care. We may ask some people who maybe don't do as much clinical care to join a care team of nurses in order to further take care of those patients who need the COVID type care rather than a routine care that we deliver.
We've all heard the stories, about someone contacting COVID and not having any symptoms at all. And then there's others who end up on ventilators. What determines the level of severity someone will receive, what they'll go through if they become sick with the virus?
So that's a great question, and a lot of people wish they could understand that a little bit better. So what we do know is that if we look at the population of individuals that are hospitalized, they are predominantly older or have multiple medical conditions. So we can say that those are certainly risk factors. We know that there are occasionally younger people who can also get sick. But if we look at any individual, it's very difficult to know why exactly that individual person became more ill from COVID-19 than did someone else. But the two risk factors continue to be age and multiple comorbidities.
We were talking about the increase in numbers in our area. Do you anticipate having to again postpone non-emergent surgeries? And to piggyback off that, what is considered a non-emergent surgery?
So we have already experienced enough of a surge that we have started to make modifications to our non-emergent medical care, medical services in the hospital setting. So I want to first emphasize that unlike the spring, we are not adjusting and don't anticipate an adjustment to outpatient, office-based medical care. In the spring, that was significantly curtailed. So today at Corning Hospital, we have already reduced the non-emergent inpatient surgeries. And we're going to continue with that plan for the next couple of weeks until we see where this post-Thanksgiving surge takes us. So non-emergent care is really talking about care that is which can be delayed and not impact someone's life or injury to an organ or their organ system. So in other words, if there is something that is threatening to someone's function or life, that is urgent care and that won't be delayed. And it's really important, I want to add, that people shouldn't delay care because they are concerned about coming to our facilities. It continues to be important for people to feel comfortable and confident that we will protect them in our facilities. We know in the spring, people delayed coming to the emergency room, and that could impact serious situations like possible heart attacks or strokes. And so we really want to emphasize, if you have a situation where you're concerned about the symptoms you're experiencing, don't hesitate to call your physician or come to the emergency room.
There's been so much discussion about a possible light at the end of the tunnel with the vaccine announcements. What do you expect in terms of COVID vaccine availability to us regionally?
So we certainly have all looked forward to the vaccine as we look for more and more tools to try to slow the spread of the virus. We continue every day to learn more and more about how it's going to be distributed and what we're going to receive in the region. What we do know is that the priorities will be those that live in long-term care facilities and healthcare workers that take care of those individuals or have high-risk exposure in our hospitals. So the first wave of individuals that will be offered the vaccine are those groups. We expect that's going to happen fairly quickly. As a matter of fact, we probably expect that in the next week or so. As far as vaccine for the general public, that is going to be further down the road. Those high-risk areas will receive the vaccine first, And we fully expect it'll be late winter by the time it's available for all of the general public.
To piggyback off that question, we return to WYDC TV Big Fox COVID-19 specialist, Amanda Decker.
And what would you say to those who are fearful of getting this COVID-19 vaccine?
No need to be fearful. So I just was reviewing some of the data this morning. More than 100,000 patients have now been through the vaccine trials, and there are no significant side effects. There are the typical side effects from a vaccine. You may get a soreness in your arm or some minor reactions, but as of right now, there's no reports of significant side effects with any of the vaccines. And I do trust the FDA would not release a vaccine that in their scientific expertise is not safe. That's just not going to happen. Conversely, it has a high degree of effectiveness. And so for the people that are really thinking about the risk-reward balance of this, the risk is low and the benefit is significant. And so it is the right thing to do, and people should feel comfortable and confident receiving a vaccine.
We've all seen the troubling polls and statistics about mental health during the pandemic. What advice do you have for those struggling with mental health issues related to the pandemic?
You know, on a personal level, I've tried to divide this into two categories, if you would. One is avoiding those things that are causing you more worry. And so I know this may sound a little odd, but really giving some thought to what you're reading and watching and finding a balance between what you would normally have done in gathering information, experiencing the news, etc. Find a balance and do it consciously. And the second is we all like routines, and you have to establish new routines. And I think what COVID has done to us is it's taken away our usual routines, and we haven't found our way as a larger society to reestablish other things. I know in my neighborhood, I see people out for walks that I've never seen before, and I think they're people that are trying to establish their own new routines, things to do that are allowed in the COVID world that they may not have done before. So I would encourage the people that are listening to this to find their new routines, to allow themselves some normalcy. And then lastly, there are a lot of resources out there. If you think you're seriously in trouble or your family identifies a member that is, reach out to the many, many organizations, whether it's at work or public, community-based agencies. There are a lot of resources for people that are having mental health issues, and please don't be hesitant to reach out to those now.
That's great advice. Thank you. And why is it important that people remain vigilant right now in helping to decrease the spread of COVID? What things do we still need to do to keep this in mind, to keep this active in our mind?
Well, they're simple, and we've mentioned them many times, but they remain just as important. What we've learned recently is that this latest surge is very much tied to small gatherings rather than larger gatherings, and gatherings in the home. So aside from making sure that we maintain social distance in public, that we wear our masks, when you're in a small gathering at home, do your best to keep that small. Meals are a considerable risk, so limit the amount of time that you have a meal with those individuals, and really continue to do those few things that can help prevent the spread.
I like to ask this question because I think it's important to hear your response. What is a community outreach and the thank you from the community meant to you at Guthrie?
So this is a really important concept. I don't think Dr. Scalzone and I, maybe we don't need that reassurance or that pat on the back, but I can tell you that our frontline workers, the nurses and the aides and the staff and the receptionists, they really appreciate that pat on the back. And so we just talked about mental health. It's a component of their mental health. They appreciate the sentiments of gratitude and appreciation for the courageous hard work that they're doing.
Well, I want to thank you for being a part of our informative discussion on COVID-19. And I also want to thank you for all that you've done during this pandemic.
Thank you.
Thank you.
Thank you for watching our informative discussion on COVID-19. With Guthrie, Arnot Health, and WYDC TV, Big Fox.